So you're looking for a shoe for pronation or overpronation. And actually it's pretty simple. It's kind of a daunting task initially, but we're going to help you with that. Maybe you're looking for or were told that you need a shoe that for support. Well, that's like having your doctor tell you you need a medicine for hypertension and go out and get some. It doesn't give you a whole bunch of assistance. Not all shoes are the same. Do you need a soft shoe? Well, pronation is the shock absorption part of the body. That's a pillow. You don't need anything softer if you're an overpronator. Do you need a high arch? Does it need to be expensive? Well, the goal of the shoe is to help the foot function better and help support an orthotic. So the key focus and the area we're going to look for in the shoe is the back. That's where it controls the rear foot, the heel area, and that's the most important part. We have a video on my website that shows a great example of overpronation that might give you a visual of what that looks like. So what the shoe needs to do, that wall that's set up in the shoe needs to withstand 2 to 4 times your body weight just walking. And with running, that can generate up to 6 to 8 times per step your body weight. That's an amazing force. And that wall, that's the heel counter, has to be pretty solid. So let's go kick some tires. The heel counter is the part that circles the heel. And when you squeeze it, it should be firm. You shouldn't be able to move it at all. It should also have an insole that's removable. It should not be glued in. And here's another example of a running shoe. Very comfortable shoe, but it has a very flimsy back of the heel. Not a great shoe for an overpronator. Not going to help us out. And that heel counter comes in all variations. We had a first example was very rigid. This is that moderate state. Now it has an orthotic in there. If I pull the orthotic out, it's moderately flimsy. Yeah, moderate. And when you put the orthotic in, it's very firm. It has to be firm without the orthotic in there. And probably my ultimate shoe that has the most control is going to be my hiking boot. Virtually you can have 2 trucks run and hit the back of this and it doesn't budge. An amazingly great shoe to help control pronation. And it's the heel counter that's the big part of that. So there's some demonstrations for you. Now it's not the sole of the shoe. It could be made out of EVA, foam, peanut butter, horse manure. That has very little effect compared to the heel, the rear foot counter. And running shoes are basically like fad diets. You look back at some of the trends you may have bought into, the minimalist shoe, the springs and coils, the flared soles. If you're still rocking those shoes, you probably still have a mullet. Just saying. A lot of my patients ask me, what about sandals? Well, sandals don't have a heel counter. So there's actually no rear foot control at all. It's really an oxymoron. Don't expect to get any control. I'm always amused by the sandals that say that they're for pronators. Not the case. They may be comfortable, they may be soft, but they're not going to help control the foot. Now, all manufacturers will make a shoe that has a strong rear foot counter, the heel counter, but it's not in all their models. And that's what you have to look for. And that's what makes buying shoes online very, very difficult for this. They talk about as a pronating shoe, but they talk about the sole, but they never talk about the heel counter, which is the most important part. So we're not after a specific brand, and you may find shoes from dress shoes to athletic shoes that have that. That's great. Women's shoes are a little more difficult, especially the fashion shoes. Fashion and biomechanical control are never in the same discussion. And children's shoes can also be a big challenge, finding something with a very stiff back of the shoe. Now there is one exception that has a very stiff back of the heel counter. It's called the Dansko. They're clog, very, very rigid, but it's so wide that the foot can still rock back and forth in the shoe, and it doesn't give us a whole bunch of control. So in summary, we're not after a specific shoe. We're after characteristics in the shoe, and that's what you look for. I hope this has been very helpful for you. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.